thank you all for being here again. I appreciate you taking the time to join us for this conversation about the APCD-CDL version 4 on Charles Hawley. I'm the Director of Projects with the National Association of Health Data Organizations, and I work with essentially as staff to the APCD Council and work closely with the APCD-CDL. I'm grateful to be joined by my colleague and friend, Janice Bourgault, who is a senior consultant with Freedman Healthcare and is going to kind of help us go. And also, importantly, the APCD-CDL Steering Committee Chair. And so is going to help us go through this conversation presentation. So let me first, though, just introduce a little bit of the APCD Council. The APCD Council is a program of NAHDO and a learning collaborative of government, private, nonprofit, and academic organizations focused on the development and use of state APCDs or all payer claims databases. So you can see here that we are in a lot of ways interested in sharing information with states to help them bring these APCDs online. And then this is very briefly just kind of a little bit of a look of the national map and where there are APCDs in existence, or some of them that are kind of in implementation or even sort of just interest. And I think with that, I'm gonna ask Janice, bring Janice back into this conversation and ask her to maybe take over the presentation of the CDL.
Right. Thank you, Charles. Can you hear me okay?
Thank you. Yep, I can hear you great.
All right. Good afternoon, everyone. I'm Janice Bourgault. As Charles mentioned, I'm a senior consultant at Freedman Healthcare. Today, I'll be presenting on the APCD-CDL maintenance process that occurs every 2 years and the results of this past year's process, basically the updates that have been made in APCD-CDL's latest version, version 4.0. First, though, I'd like to take a minute to thank everyone that has contributed time over the past year to participate in the process. It is very much appreciated. So thank you to all of you. So we thought we'd start with background on the APCD-CDL and how we got where we are today, which has now been implemented in 4 states, and a few other states are currently contemplating considering implementing the CDL. So that's great news. It's starting to get a little traction. So when APCDs first started about 20 years ago, this was also around the time when the X12 HIPAA standards were first being implemented, along with other standards like provider NPIs, taxonomy specialty codes, etc. And with that said, the initial APCDs did use the X12 standards as a reference to develop their data submission guides, and that initial group of APCDs were somewhat aligned in their technical specifications as early adopters. However, as more and more states implemented APCDs, they expanded their data submission guides based on new data needs, updated X12 standards, lessons learned from those early adopters, and also based on state-specific initiatives and legislations. So now there was less alignment in the data submission guides across states. The APCD Council started to hear from payers as the variance in data submission guides made it very difficult and costly for payers to meet and maintain different requirements across all the APCDs. In addition, updates to data submission guides usually occurred at the first of the year for all APCDs. So this further compounded the level of effort for payers to have to revise and test revisions for multiple states during the same time frame every single year. So it was a real burden. With that said, the overall majority of data elements, however, are the same across all APCDs. And in 2009, the APCD Council and AHRQ launched an effort to determine what those core data elements are, but no standard was developed at that time. The infamous Bourgault versus Liberty Mutual decision in March of 2016. Because of that, there was a reboot of these discussions and efforts to standardize APCD data collections. Next slide. So as part of this development, the APCD Council reviewed all existing state APCD data submission guides to identify consistency or those core data elements and divergence data elements reported by one or a few states across all of the APCDs. The APCD Council worked closely with many stakeholders, states, vendors, payers, etc., to review every proposed field to see what should be included. They also worked with the stakeholders to develop the structure of the files, standardize the header and trailers, and release the first version of the APCD-CDL in 2018. The first maintenance cycle occurred 2 years later in 2020, and this is now the scheduled cadence for the CDL, where every 2 years the committee meets and reviews the data maintenance requests and releases a new version. This also alleviates states, payers, vendors, etc., with needing to make revisions every year. They can expect an updated guide every 2 years. Next slide. So the APCD-CDL maintenance process starts with data maintenance requests, or DMRs. They are received via the APCD Council website, mostly during the first 6 months of what I'll call the CDL maintenance year, which, like I said earlier, occurs every 2 years. For this past cycle, January, June of 2024, 22 requests were received from 4 different organizations. This is a decrease from the previous cycle, mainly because earlier versions of the CDL did need more refinements. This round, there was also a lesser need for refinements, and more attention was paid to reviewing requests for new data elements or to clarifying the language of what is to be reported. As far as reviewers, there were 62 reviewers representing 39 organizations. These reviewers were provided the opportunity to review the data maintenance requests. As far as participation goes, this was an increase from the last cycle due to there being much more interest in the CDL and more states having implemented the CDL as their data submission guide. The next step is receiving comments after this review. We received comments from 6 organizations, including state agencies, APCD management vendors, and the Payer Association. The Maintenance and Review Committee, which included many organizations, then reviewed and discussed each data maintenance request to further clarify and refine the request as needed, and to decide if the requested revision should go to a vote or not. Only NAHDO members could cast a vote, and only 1 vote per organization. There were 16 voting members, so 16 organizations that were NAHDO members participated, in addition to many other organizations. So during these discussions, the outcome was that out of 22 requests, 7 requests were withdrawn from consideration, and 15 requests were approved for incorporation in the next version of APC-CDL. And we'll review those approved revisions in later slides. Next slide. So as I previously mentioned, the maintenance request process happens every 2 years. The DMRs are submitted on the APCD Council's website and are due on June 30th of the maintenance year. This past year, 2 meetings were also held earlier in the year, one in March and one in April of 2024, giving the Maintenance and Change Committee a head start on reviewing requests that had been received to date. All requests were posted for public comment for 30 days and then sent to the Maintenance and Change Committee. And then starting in September of 2024, the Maintenance and Change Committee met biweekly to review and vote on the DMRs. The APCD-CDL was then finalized in December, and all revisions noted in a changelog, which brings us to today's webinar and the actual release of version 4.0 later this week. Next slide. So now we'll go through the list of revisions that are in version 4.0, starting with the eligibility file. So the first change was on the eligibility month. The language was clarified to state that only one record per member per month per plan is required. The clarification was requested for multiple reasons. One, to make sure all records are reported. So if a member has two plans with an insurer, for example, a child covered under each parent's plan, and they both happen to have coverage from the same payer, that both of those records for that child would be reported. But also to provide guidance for other changes that would not trigger duplicate records. And in this case, an example would be that a member has an address change. And so a separate record with the new address should not be reported. The payer should decide which address they will be using for reporting that change in address, whether they use the address at the end of the month or the last coverage date, etc. So that clarification was made on eligibility month. Other revisions on the eligibility file included the race and ethnicity fields. So these fields reference the CDC code set version 1.2. However, the code set includes two sets of codes, concept codes, which have a length of 6, and the lengthier hierarchical codes. So for these codes, the language was revised to clarify that the concept codes are the codes that should be reported, but revised the length of the field to allow flexibility for states collecting the hierarchical codes. Next slide, please. Moving on to medical claims, there was language and code sets were further clarified. So starting with service units and quantity, the language here was clarified to note that the quantity, oops,
Excuse me.
that's okay. So the language was clarified on the service units and quantity to note that the quantity is usually based on the relevant CPT HCPCS code. So within CPTs and HCPCS, it's usually designated the basis of the quantities. So for example, an office visit, the unit is usually 1, it's 1 visit. Ambulance, again, the codes refer to the number of units being in miles. So language was clarified to designate that, and this should also reflect how claims are being billed as far as what's filled in that quantity field. For data service from, there was language that said that dates of service should be within the coverage period on the eligibility file between the plan effective date and the plan term date on the eligibility file. Well, since the eligibility file dates are based on enrollment and claims are based on pay dates, that language was removed. Present on admission codes, so all 25 of them, or 25 of them. The references were corrected, the X12 references were corrected, and also the codes and descriptions were aligned with the UB04 billing standards. Next slide. So for pharmacy claims, 3 data elements were impacted. So first, the drug name or compound drug ingredient list. Previously, this field or data element was specific to the reporting of compound drugs only. So if the service line was for a compound drug prescription, that the compound drug NDC codes would be reported in this field, and if no NDC, then the names of the compound ingredients would be reported. Since there was already a field to report the NDCs, there was really no need to also report the NDC in this field. In addition, there was also a separate request to include the drug name as reporting the drug name here in addition to the NDC codes. This one was revised to include just the drug name, no matter whether it was a compound drug or not. So you have your NDC field, and a drug name field. So this was made more generic and not related just to compound drugs. The reason for this was that it's very helpful for downstream research and analytics, especially for researchers that do not have access to a drug reference software or database such as Redbook or Medispan. This allows the drug name to be reported along with the NDC and passed along to researchers. Let's see, the next one, quantity dispensed. So that field was just updated to format, as far as the format, to align with standards. As far as record status code. So the record status code in the pharmacy claims file is really the equivalent to the claim status code in medical files. So this is what designates on the medical side and dental whether the claim was paid as primary or secondary, denied, etc. In pharmacy, this record status code was based on the NCPDP standards, and there's no distinction on they don't have the codes that distinguish between primary and secondary claims. So, and it's also not consistent with what is being collected in most APCDs. So most APCDs are using the claim status code that is used in medical and dental. So it allows for a consistent code set across all of those files. So here in pharmacy files, the CDL is also making that change in that the record status code will now use the same code set, which is the X12 code set that's being reported in medical and dental files. And we also believe that making this change will ease the transition for existing states moving to the CDL, that will be consistent to the code set they're using now. Next slide. On the provider file, data element that was previously called Provider Medicare Provider ID was revised to just read Medicare Provider ID, and additional guidance was provided on which Medicare Provider ID to report in this field. The committee decided that the CMS certification number, the CCN number, is the one that would be reported in this field if applicable. Otherwise, it would be left blank. Next slide. And then there were other updates, other data maintenance requests. So starting with updating of the description for the insurance product codes that are reported on claims. These updates were made to provide more guidance on which product code is to be reported on claims if a member had a change in plans or product code. It would be the product code that was applicable at the time of service is the one that should be reported. And also there was a note made because there are non-X12 standard product codes included in the CDL, mainly to accommodate APCD specific reporting needs, such as there are multiple codes for Medicare Advantage plans, for example. There's the traditional code for HMOs, but then there were also others added for PPOs and POSs, for example. There was a note added that highlighted the use of non-standard product codes in the appendix. The record type, there was a little bit of cleanup on the record type descriptions in each of the files. And in the front matter, updated language to clarify submission requirements with additional guidance on the reporting of the financial amounts. Next slide. So as far as additions to the APC-CDL, the biggest one is that the committee unanimously voted to include the non-claims payment layouts that were released last April into the APCD-CDL standards. And Charles will go over that in just a minute. So what this does, as far as incorporating the NCP layout in the CDL, it means that the NCP layout will now follow the same data maintenance process as the CDL, which will help also ensure consistency across all the files. So now I'll hand it over to Charles to provide more details on the NCP layout.
Thank you, Janice, and thank you for the excellent overview of all those changes. So I will just kind of dive in here, and in case, just maybe I'll go back really quickly. In case in the future slide this isn't called out as clearly, I want to make sure that we do mention what's mentioned here, which is that there were a couple of additional edits made to the NCP data layout to clarify the reporting of the member count and the member months specifically on the annual payments file. And so, yeah, those otherwise the NCP data layout that's being incorporated is the same as what folks may have been aware of being published back in April, as Janice mentioned. And so let me take you through a little bit of the NCP data layout development timeline in kind of a similar way that we did with the CDL at the beginning. And this is really just to give everybody a little bit of context about the need and also the process, right? So in 2020, APCDs were those that were required to collect non-claims payments asked the APCD Council to develop guidance as part of the first APCD-CDL maintenance process, which was back, that one back in 2020 that Janice mentioned. And during that time, the committee established a work group to refine requests for the next maintenance cycle, including non-claims payments data collection guidance. So then during 2021, the APCD Council gathered use cases, reviewed draft layouts, and developed a set of consistent and comprehensive layouts with input from the work group, including 24 organizations representing APCD administrators, insurance carriers, and APCD contractors and vendors. Then in 2022, the APCD-CDL Maintenance and Change Committee received a new request to add data elements for collecting non-claims payments data to APCD-CDL version 3. And after establishing another NCP data work group, the non-claims payments data work group in 2022, the committee voted to postpone inclusion of those non-claims payments fields in the CDL due to a lack of national standards to reference and critical time constraints, but encouraged the work group to continue advancing non-claims payments data collection guidance, which we did through 2023. And in 2023, we took the guidance that we had developed previously and had been refining over this time period to the NAHDO meeting in Boston, the in-person meeting, and the APCD Council presented the NCP data collection guidance developed by the work group and reviewed the introductory text and draft file layouts with all of the attendees. Afterwards, staff incorporated attendees' feedback and reviewed the updated guidance with the work group to finalize a proposal for distribution and comment from the public, particularly from data suppliers, and that was in December of 2023. Then in January of last year, so a year ago, we circulated the proposed guidance to the work group and 27 additional organizations, including 9 insurance carriers and AHIP, to request comments and questions. We ultimately hosted a well-attended webinar last February to ask to kind of show what we've done and make sure that we had any final feedback. And we incorporated the guidance that we received before publishing the version 1 of the NCP data layout in April of 2024. And so let me say a little bit more. I alluded to what was in NCP data layout a moment ago when I mentioned the member count in months, elements, and annual payments. So there are 3 files. The NCP data layout also has references to the CDL. So, I'll explain that here in just a moment, but the 3 files are primarily the annual payments file, which accommodates data on contractually based non-claims payments made by a payer to a provider. And you can imagine there are a number of different types of those, but it accommodates a number of payment categories. And this is an opportunity for me to mention the expanded framework, which the California Department of Healthcare Access and Information developed in partnership with Freedman Healthcare and I believe, Baylet Health to put forward some proposal on what those categories ought to be, and those are the categories that are used within this layout in that file. That was a really important hurdle to kind of capturing all of the contractually based non-claim payments that you can kind of imagine in the ecosystem. Another file here is the prescription drug rebates, and this accommodates data on prescription drug rebate payments made by drug manufacturers and PBMs to payers or fully integrated delivery systems. And lastly, capitation payments. So this file accommodates data on payments made by a payer to a provider for member, this is the important part, member attributable services under a capitation agreement. And so this is where the CDL came into play, has always been kind of in play with NCP data layout. The NCP data layout referenced the eligibility file for the sake of being able to attribute those capitation payments in this file, the capitation payments file, to a specific member. The NCP data layout has also referenced the header and trailer records from the CDL in the past. And so incorporating those things is not particularly challenging. Those were already there, but these are the new, these files and their data elements are the new additions to the APCD-CDL version 4. And so, Janice, I'll just kind of mention here, maybe I'll read through these real quick and then we can open up for any questions that folks have. Okay. So we did think a little bit about some of the questions that we've heard in the past and thought we would try to answer some of those up front. And then we were going to turn the time over and see if there were any questions that you all had for us that we might be able to answer about the APCD-CDL version 4. So first, how can we access? So we mentioned that the changelog is available. This is true for both of these things. So the APCD-CDL is publicly available on the council website. You don't need to register or request a license any longer. You can just kind of go out there and download that. I also, if you click on this link here, you go to the council website, apcdcouncil.org, and you go to the CDL section there. The changelog is published right now at the top of the main page. It says update in red letters. APCD-CDL version 4 changelog now available or something to that effect, and there's a link underneath it to the changelog, and it is that it's pretty high level, but if you're kind of curious, you can take a look there, and then the next question here is, when will version 4 be published of the CDL? That will be published in 2 days. So on Wednesday, we'll make sure that that is published. And we will also, I've actually already done this. The prior versions are now available online. So if you go again to the council website and you go to the CDL section, there's a download CDL button. If you go there, you'll see the kind of prime button. That's going to still take you to the current version, but below it, you'll see a list of prior versions, version 1.1, 2.1, and 3.0.1. And the reason I didn't produce the whole versions before is because the .1 indicator in the beginning was an indicator of errata. And so that was part of the impetus there, just posting those because the corrections I didn't feel like were necessarily all that relevant. This last question here is, do I need to implement all files in the APCD-CDL? Can I implement just one? And so yes, you may implement any part of the CDL without changing the file structure or content. And that's what we ask states to do. And there are states out there who've had this before. They've come to us and said, well, we don't want to collect social security number. That's the one, feels like always comes up, right? Or some other type of perhaps identifiable information that's sensitive, right? But you don't have to collect those elements. What we ask is that you maintain the structure and that there's a position there for that element that doesn't actually need to be collected. It could just be always blank. That's up to the states to sort of implement what the thresholds are for accepting any given element. Yeah, and so and I mentioned, I think the slide mentions here too, that there are states already using the CDL who aren't collecting dental claims, even though there is a dental claims file within the CDL. And we imagine that that will be true going forward with the non-claims payments as well. So with that said, I think this is our contact information. I mentioned the website a minute ago. I think that's probably the end of the slideshow. So I'll just kind of take that down for now and ask if anybody has any questions that they want to share with us. So you can raise your hand or you can put them into the chat, and not everybody can use the chat is the trick. So you might need to raise your hand. And if you put it in the chat, I'll make sure to read it so that everybody can at least hear it, if not see it. Neely with HCI asks if the slide deck will be available after this presentation. And yeah, I've downloaded the slides and I was going to send it around with the link to the website so that you all can, I mean, it's in the slides, but I was going to send it as well so you can see the change log basically if you'd like. So yeah, we'll send that around shortly. Janice, perhaps oh, thank you. Thank you, Christopher. I see, congratulations. Appreciate that. Janice, it seems like maybe we've described it perfectly. So, or perfectly imperfect, one or the other, but
yeah. But feel free to follow up with any questions.
Yeah.
You know, Charles did put his email address at the end of the slide deck, so feel free to reach out.
Yeah, please do that. I'm Charles at NAHDO.org. You send it to info. But yes, reach out if you have any questions or if you need anything. And thank you all for taking the time. And just let me again echo Janice's appreciation for all of the organizations involved in this. It really is such a team effort, and it's there's a long list, and thank you all for being a part of the maintenance and change committee, for all the time spent on going through and reviewing the requests and making sure that they fit and that they kind of meet the needs and everything else. We really appreciate that. So thank you to everybody, and let us know if you have questions. Have a nice day.